To shine a light on some of the great work being done by our team and the people we are working with across the healthcare system, we've decided to host an inclusive digital transformation week as a way of sharing some of our stories, learning, assets, and to hopefully propel the change that still needs to happen to make digital healthcare equitable. I'm joined today by our evidence and evaluation lead, Sanah Ali. Sanah, do you want to introduce yourself and tell us a little bit about your role and how you came to Thrive by Design?
Yeah, sure. So hello, I'm Sanah. I've worked for Thrive by Design for just over 2 years now. My background is in psychology, so I have an undergraduate degree in psychology and a master's in cognitive neuroscience. And I lead on research and evaluation in the team, so I'm pretty much involved in all of the projects that we do. And as you'll know, each project has different needs, so each day is never the same too.
So a bit like mine, you've a varied and exciting role that touches actually on quite a lot of the work that we're doing. But today we're going to talk specifically about mapping and digital exclusion. This work started in the east of England with the team at Norfolk and Waveney ICS. Can you give us a little bit on the background of the project and what we set out to do?
Yeah, sure. So we've been working with Norfolk and Waveney ICS to understand where digital inclusion efforts should be targeted across Norfolk to focus on number one, which is the greatest need, and then also to build on existing capacity. We wanted to understand 5 questions, which are: what areas of Norfolk are most at risk of their populations being digitally excluded? Which areas of Norfolk are at risk of digital exclusion for particular factors? So those factors might be age, deprivation, rurality, type of internet use. What digital inclusion activities are already underway in Norfolk and where? Where are the existing places that could be activated to deliver digital inclusion activities? And where are the health-related first points of contact, which may be able to refer to digital inclusion activities? So from those questions, we created a digital inclusion map, which is still a proof of concept and a prototype, but we're learning a lot from it and ultimately answering those questions that I've just mentioned.
Yeah, so the project is well underway and actually there's quite a few components to it. So would you be able to break down the different work areas for us and how they link together?
Yeah, sure. So the map we created was made by analysing a number of different data sets. And this analysis became the basis for each layer of the map. So each layer of the map tries to answer at least part of one or all of the questions Norfolk and Waveney wanted to answer. And those layers that we mapped include the over 65 population, rurality, deprivation, internet user classification, health-related support, so GPs, pharmacies and hospitals, where digital inclusion activities could happen, so for example, libraries and community centres, and what digital inclusion activities are happening already. So alongside the map, we also created an index, which incorporates all of the data sets we collected and looks at risks and assets to generate a score to help us to see what areas should be in focus when considering interventions. And from this, we can identify the top 10 areas at high risk, which is really useful. Cross-referencing the index with the map means that people can investigate whether there are assets in neighbouring areas that could be mobilised as part of a response. So that's the map, and we've also created some other tools to go with the map. So the first one is an assessment tool. So GP practices are a good place to identify those who may need help to get online, but we know that GP and nurses don't have time to do it. So we put together a leaflet to help people know what support is out there. We've also created a digital inclusion savings tool to show the impact of digital inclusion activities in terms of money saved for public services and also for individuals. And we've also created an evaluation framework to collect quantitative and qualitative data to show the human impact of the work happening. So those tools that I've just mentioned are, again, still a work in progress and currently being tested out. And to share the map and all of those tools, we've used the website Notion, which we really like as a way of sharing our work.
It does sound like really interesting work and actually quite complex. What have you yourself learned along the way in doing this project, do you think?
So I've not really developed a map before, but with the help of our expert associate Tom French, we worked really hard to create this tool, and the map itself is really valuable. It answers many questions in a really neat visual way. And again, the map is a proof of concept, and we do expect it to evolve over time as we learn what is most useful to show. There are obviously some limitations to the map. So for example, the map isn't fully accessible. But since creating the map with Norfolk and Waveney, we've also done the same in Nottinghamshire and with Cheshire and Merseyside. So as we do more of this, we're working through any issues that arise, as well as looking at other tools which might be a better fit. So we currently use Google Maps, but there might be other tools out there like Tableau, which could be a better fit. I also learned how to code again. So during my master's, I did some coding in Python to analyze some big data sets, but since then I've avoided it until creating the map, where I had to use RStudio to analyze the data. So that was really interesting, but again, all good experience and useful to know.
Yeah, definitely, it sounds it. The team over at Norfolk and Waveney, who we kind of delivered the first version of this project with, they're kind of trailblazers with inclusive digital transformation, and obviously we've worked with them quite closely. This was also one of the first system-wide projects that we took on. What do you think are the benefits to this project from it being done at a system-level perspective?
So I think there's a lot of benefits. One main benefit being that sharing and joint up thinking works better than place-based project. As you know, you won't have that limited reach. So that's definitely probably the biggest benefit.
Yeah, I totally agree. For that to be our first system-wide project, it really did lend itself to the data and analysis looking right across the patch rather than focusing in on a place-based kind of locality. So just thinking about that, what do you think are the key learnings from this work? And are there any other plans around spread and scale?
So like I mentioned before, since creating the map with Norfolk and Waveney, we've also done the same in Nottinghamshire and now with Cheshire and Merseyside. And it's really interesting how there's so much potential with the map depending on the questions you want to answer. So for example, with Nottinghamshire, we were really interested in looking at primary care networks within the map. So we added a primary care network as another layer and also created another index solely for primary care networks. And that index ranked the primary care networks in order of average overall index score, so from highest to lowest. And this ranking may support decisions about whether primary care network areas are most in need of support. And with Cheshire and Merseyside, there are conversations about what other indicators we could add to the map, so such as GP data. So we are really developing these maps, and there's definitely ways to scale it, which is why we're internally working hard to make sure we're doing the research and training and testing of the mapping tools to ensure we can support the work.
Yeah, it's been really interesting to kind of see that work grow and to see it kind of now spreading around the country, kind of already been embedded with 2 ICSs and another one kind of that's just kind of initiated that project. That's been so interesting to chat today and to find out more about this, as actually it's something that out of all the projects we do, I've not been that close to. So if likewise you would like to find out more information on this work, please do get in touch with us. Or if you head over to our website, you can check out Sanah's latest blog, which she has written about this. So Sanah, thanks so much for taking the time to chat today, and I will hopefully see you soon.
Thanks, Rob.